If you've ever struggled with a blocked nose during exercise and you have been told that you have a deviated septum, you might have wondered whether surgery could help you. There is a specific operation designed to surgically treat and correct a deviated septum in order to improve airflow through your nose. And that operation is called a septoplasty. So in this episode, I'm going to cover exactly what a septoplasty involves, what the intended benefits are, what the possible surgical risks are, and what you can reasonably expect before, during and after the procedure. And crucially for the athletes watching this, we'll look at what the scientific evidence says about whether surgery can help you improve your overall performance. If you're new here, I'm Dr Guled Jama, a consultant ear, nose and throat surgeon based in London, and I specialize in nasal airway surgery and optimizing nasal breathing for sports performance. And in this series, my goal is to break down common nasal and sinus related problems that affect many of the athletes that I see, and to give you a clear overview of the treatment options that are available to help you breathe better and perform at your best. Let's get into it. Okay, so before we begin, it's important to be clear that surgery may not automatically be the right choice for everyone with a deviated septum. In fact, a deviated septum is relatively common in the general population, and for many people it simply doesn't cause any significant problems with their breathing to warrant a surgical correction. The decision to consider undergoing a septoplasty really comes down to whether or not you feel that your symptoms are significantly affecting your breathing, your sleep, your training and performance, and your overall quality of life. It's also worth considering giving non-surgical treatment options a fair trial first. And in other videos on this channel, I talk a lot more about conservative and medical treatment options for nasal obstruction. But essentially, to briefly recap, non-surgical treatment options include nasal steroid sprays and saline rinses, and these can be very helpful in reducing any coexisting swelling or inflammation of the nasal lining on top of an existing deviation. They're worth trying if your symptoms are relatively mild or moderate, or perhaps you're thinking about whether surgery is the right choice for you. So I would recommend you speak to your doctor if you have any questions related to medical treatment options for nasal obstruction and which ones may be helpful for you specifically. A key point to remember, however, is that a deviated septum is ultimately a structural problem. Therefore, no spray or tablet or any other medication is going to straighten a bent piece of cartilage or bone. So if your symptoms are ultimately mainly down to the shape of your septum, rather than any coexisting rhinitis, for example, medication is unlikely to make a significant difference. If you're someone who has used nasal sprays consistently and you're still struggling, I would recommend undergoing a thorough assessment with an experienced specialist to discuss whether a septoplasty might be the right option for you. Let's talk about the procedure itself. Septoplasty is a procedure that reshapes the nasal septum, and that's exactly what the term essentially means. The aim is to straighten the deviation so that the narrow side of your nasal passage can open up, improving airflow and making breathing easier. It's important to understand that a septoplasty is a purely functional procedure. In other words, the goal is to improve breathing and not to change the external shape of your nose, for example. However, if you're someone who has a deviated septum and a visible change in the shape of your nose, these two aspects can be surgically corrected at the same time. The combined procedure is called a septorhinoplasty, which is a slightly different and more complex procedure. And I cover septorhinoplasty in detail in a separate video, so feel free to check that one out after this one. A straightforward septoplasty is performed entirely inside your nose, so there are no cuts to the outside of your nose and usually no visible change to how your nose looks from the outside. The operation is typically carried out under general anesthesia, meaning you'll be fully asleep. It usually takes anywhere from 30 to 45 minutes, but very much depends on how complex the deviation is. During the procedure, your surgeon makes a small incision inside one nostril, which is completely hidden. And through this incision, the lining of the nasal septum is carefully lifted away from the underlying cartilage and bone. The parts of the septum that are bent or blocking the airway are then reshaped or removed as necessary, and the remaining septum is repositioned into a straighter alignment. Finally, the lining is then placed back over the septum and the incision is closed using dissolvable stitches. Occasionally, your surgeon may place small flexible splints inside your nose to keep things stable in the early healing phase. And these splints are usually removed at your follow-up appointment, typically within the first 1 to 2 weeks after surgery. In most cases, a septoplasty is performed as a day case procedure, meaning you can go home the same day after a period of observation in hospital. For the first few days after surgery, it is entirely normal for your nose to feel stuffy, especially if internal splints are in place. This is completely normal and not a sign that anything has gone wrong. The lining inside the nose can swell after surgery, and this can take time to settle. During the first week, you may therefore feel as though you can hardly breathe through your nose at all, and many people rely on mouth breathing during this time. Again, this can be reasonably expected. However, most people feel well enough to be up and about, and if you have a desk job, you can usually return to work within 1 to 2 weeks, depending on how you feel. Although you may be back to your normal routine fairly quickly, the healing process continues for longer. It can take up to 3 months for the swelling inside the nose to fully settle and for you to experience the full benefit of the operation. You should be given specific postoperative care instructions after surgery, and the key points to remember are: avoid blowing your nose forcefully for the first 2 weeks, as this can disturb the healing tissue and trigger a nosebleed. If you need to sneeze, try to do so with your mouth open to reduce any pressure inside your nose. Sleep with your head slightly elevated, for example propped up on a couple of pillows, as this can help reduce any swelling. Avoid any excessive bending or heavy lifting or straining in the early recovery period, as these increase the pressure in your head and raise the risk of a nosebleed. Do use saline nasal sprays or rinses as directed to keep the nasal lining moist and support healing. Let's talk about getting back to exercise, because this is one of the questions I get asked the most. The big theme here is patience. For the first week or two, it's really important that you avoid exercise altogether. So no running, no gym sessions, no cycling, nothing that gets your heart rate or blood pressure up. In the early phase, the main thing we're trying to avoid is a difficult to control nosebleed. After about 2 weeks, and assuming that your surgeon is happy with how things are healing, you can usually start to bring in some very gentle activity. That might be walking or light spinning on a bike, but again, probably best to avoid anything that leaves you out of breath or straining. From around 4 to 6 weeks, most people can begin to work their way back towards normal training. The key is to build up gradually and to listen to your body. If you notice any pressure or pain or mild bleeding from the nose, that's your signal to ease off. Regarding contact sport or anything where there's a real chance of knock to the face, I personally recommend this is usually off limits for at least 6 weeks, and sometimes longer depending on your recovery and your surgeon's advice. The bottom line is this: if you rush back too quickly and potentially disturb the healing septum through heavy bleeding or an injury, you may end up setting yourself back much more than if you'd taken that extra bit of time to recover properly. So remember, patience is key. Now let's talk about the risks and complications of surgery. Like any operation, a septoplasty does carry some surgical risks. Most of them are relatively uncommon, but it's important to know about them before you go ahead. The first one is bleeding, which we touched upon already. This one is actually relatively common, and some light blood-stained mucus in the first few days is completely expected and usually settles within the first 24 to 48 hours. Infection is another risk that can occur, although it's not very common and is usually treated with a course of antibiotics and in some circumstances some antibiotic ointments in the nose. Another one is what is called a septal hematoma, which is a collection of blood inside the septum itself. It's rare, but if it does happen, it needs to be drained relatively urgently to avoid any long-term damage to the septal cartilage. So if you develop a marked swelling inside your nose or your septum feels swollen, get it checked rather than ignore it. Very rarely a small hole can form in the septum called a septal perforation. Many people may not be immediately aware of it initially, but in some cases it can cause crusting, dryness in the nose, or a slight whistling noise when you breathe. If this happens to you, it is something that can be dealt with and repaired as required. Another one that some patients experience is a temporary numbness in the upper gums or front teeth. This usually settles over time without any specific treatment required. A change in the shape of the nose is extremely unusual after a straightforward septoplasty, but it is possible, particularly if a larger amount of cartilage was resected or reshaped. Most patients do notice a significant improvement in their airflow after surgery. However, in some cases, a degree of nasal blockage can persist, especially if there are other issues such as enlarged turbinates or weaknesses of the nasal cartilages. Your own surgeon should go through each of these recognized risks with you in detail and help you understand how they may apply in your particular case. For most people with a clear, significant septal deviation and a genuine nasal obstruction, septoplasty usually leads to a noticeable improvement in day-to-day nasal breathing. Over the last few years, we've started to get much stronger clinical evidence to back this up. A large UK study published in 2024 directly compared adults undergoing septoplasty either with or without turbinate reduction with those receiving medical treatment alone using nasal sprays. And in this randomized controlled trial, patients were randomly allocated to either surgery or medical treatment. 6 months after treatment, people who had surgery reported on average about a 20-point greater improvement in their symptom scores than those on nasal sprays alone, and that benefit was still present at 12 months. Quality of life scores and objective airflow tests also improved much more significantly in the surgery group, and those who started with the most severe symptoms tended to get the greatest benefit from surgery, which is really helpful to know when deciding whether or not surgery is likely to benefit you. So what does all of this mean if you're an athlete? For you, that improvement in how easily air moves through your nose and how little your symptoms bother you is exactly what you're trying to tap into when you're training and when you're competing. Other studies have shown that restoring nasal patency after septoplasty can improve measures of physical performance and cardiorespiratory function because you're simply able to move air much more efficiently. If you've spent years running or competing with a bad side or switching to mouth breathing relatively early on and constantly feeling restricted, the difference after a successful septoplasty can feel quite substantial once healing is complete. However, it is still worth keeping expectations realistic. The improvement isn't instant and it may take several weeks to a few months before you experience the full benefit. But if your nasal obstruction is genuinely driven by a deviated septum, and that has been confirmed on clinical assessment, current evidence suggests that correcting it is often a key part of unlocking much more efficient and comfortable breathing for sports performance. So if you're seriously thinking about septoplasty, the first step is to get a proper assessment by an ENT surgeon who is experienced in functional nasal surgery. That assessment should look not just at your septum, but the entire nasal airway, including the turbinates, the state of the nasal cartilages, as well as the lining of the nasal cavity for any signs of rhinitis or inflammation. Many athletes have more than one factor contributing to nasal obstruction, and if you only treat part of the problem, you may end up disappointed with the result. A thorough assessment is therefore key in making sure that you're choosing surgery for the right reasons, with realistic expectations and with a clear plan for how this fits into your wider training and performance goals. So, to summarize, septoplasty is a well-established functional nasal operation designed to straighten a deviated septum and improve nasal airflow. It usually involves a relatively short procedure under general anesthesia, a few weeks of careful recovery, and a gradual return to training over about 4 to 6 weeks. Like any surgery, it carries some risks, but for the right person, especially for someone with moderate to severe symptoms confirmed on nasal assessment, it can make a real and substantial difference to your breathing, sleep, training, and overall performance. If you found the information in this video helpful, I would really appreciate it if you'd consider subscribing to this channel. I would also love to hear from you in the comment section. Are you considering septoplasty? Or have you already had it and noticed a change in your training or racing? Do let me know about any specific topics or questions you'd like me to cover in future episodes. Your feedback genuinely helps me plan educational content that is most helpful for you, and it also helps other athletes discover clear, evidence-based information so they can make better decisions about their health and find reliable answers to help them breathe better and perform at their best. Thank you very much for watching, and I'll see you in the next one.